It's rather unfortunate that we spent the last couple weeks telling you guys about businesses and government agencies that had COVID-19 positives, and again, unfortunately, we have to share with our audience this morning that we do have a positive case of COVID-19 on our KUAM news team, and sorry guys, it's just.
Yeah.
I mean, we don't know where to start. We've all made the commitment to go and get tested today. It's unfortunate. And that being said, we spoke with the positive case on our news team, and she's agreed to come on and share her story with us. So we're going to bring on from the KUAM news team our reporter Adriana Cotero, who tested positive. You got your results yesterday or Saturday, right, Adriana?
Yeah. Hi, Chris and Bree. Like you said, I have chose to go public, not only with identifying myself, through work, of course, but also just letting the island community as a whole know that I did test positive for COVID. And currently I am living with the virus. But the reason I want to share this is because I feel there very well may be people in the exact same situation as I was. And that was feeling rather mild symptoms. And honestly, for a moment, and right when I called Bree and told her when I found my results out, I almost felt when I did get tested that I didn't need to, because I thought I wasn't experiencing COVID. I thought I just thought maybe it was like mild food poisoning or even something more hormonal. I'm a woman, so that was my initial thought. But as news reporters, we've learned the ins and outs of this new virus. For the most part, it's kind of taken up our minds and our daily lives. So we know that we've been told after time and time that even little symptoms in this case can affect yourself and then also bring more harm to others and further spreading the virus. So I still don't know exactly how I got it. I don't know if I will ever know, but I do know that I did not want to be someone to further spread it. That's what I knew for sure. So with that being said, we know that it is community spread now. And so have I been someone on site at places? Yeah, of course, I've been on site reporting since we were placed into Peak Court 2 and beyond. So did I put myself in the position to be exposed to many people? The answer is yes again with that. And I won't say specific places I've been, but doing coverages, but there have been instances where I've been out. And additionally, I also do have a social life. So that does include going to the gym regularly to work out, as you guys know, and also, going out to dinners and gatherings with friends. And while people I don't know anyone that has tested positive yet. Honestly, I really do not know anyone, but that didn't stop me from getting tested. So if anything, I just hope my experience will bring more people to wanting to get tested. So with that, I'll explain what I started feeling from start to finish, right. Just so I just let everyone know. So first and foremost, this morning, I feel really good. And I've felt good every single day before, except for Thursday, I'd say. So with that Wednesday, I had a slight runny nose, but I didn't see it as anything alarming in the moment because it wasn't constant and it kind of happened later in the day. And by the end of the workday, I also felt low energy, I'd say, and also I felt a little tired. So I just went home right after work and I just kind of chilled down, had a relaxed evening. And then Thursday I woke up and that's when I didn't feel well. So Thursday, I really did not feel well at all. I had stomach pains, I felt nauseous, and I had a headache. So I had every intention to go into work that day, but then honestly, like around 8:39-ish, I instead of, getting ready, I had to make an emergency trip to the restroom, I'd say, to say it in a way. But so I'd explain it as like kind of experiencing minor food poisoning that entire day. So, that includes all the works in the restroom and a headache, also feeling extremely fatigued during the day. I think I had took like 2 long naps. And I also, I told you, Bree, that same day I wasn't feeling well. And I also told our producer that day, I was like, I'm not feeling well. So I'm going to try and schedule a doctor's appointment for Friday or whenever I can get it. So luckily I was able to get a doctor's appointment Friday morning at SDA. And that included a COVID test. So Friday I woke up and I actually felt a lot better. I almost felt like I wasn't sick. So that's why I initially thought like maybe I ate something, maybe it's just something going on with, again, hormones, being a woman. But I was like, I'm still going to get tested because I know that it could be something. It could still be COVID for all I know. So I went to go get tested at SDA, and even the doctor I never had and still to this day, I have yet to have a fever, a cough, or any chest pain. So I went there and I didn't have any of the major symptoms, but I told her that I did, everything I just said, that I felt nauseous and that my stomach hurt and that I was very tired and I had a slight headache. So I went to SDA and they did the whole medical checkup. They did the swab for me. They ended up having to put it into both of my nostrils actually, because they said I have a narrow nose and a narrow nasal cavity. So they weren't able to get it swab the first nostril. So they went up the other, and it was uncomfortable, but I wouldn't declare it as being like painful or anything. So that same day I worked from home again and I stayed at the house because I didn't know yet if I was positive or not. So I didn't want to infect anyone. So Saturday, again, I stayed home, and then I felt 100% better, I'd say Saturday. I didn't have a headache at all. I had an appetite. I felt great. And then I got the call Saturday evening, and then she told me that my results were positive. Just the doctor had called me at SDA and had told me that, if I feel any worse symptoms, that I'd have to go to GMH, but that public health would be calling me soon to conduct contact tracing, and then they'll contact the places for me and they can protect my identity. And then, but because I know what this virus is like, and just from learning from it, I immediately called my parents first, who are off island, of course. And then I instantly called Sabrina. Those are my first two people I contacted, because I know I could have waited, but I didn't want to chance anything. So I called Bree, and I even had told Bree that I'm okay with even the KUAM news team knowing it's me, because if anything, I want everyone to know, just in case they have seen me or I have been around. I mean, I'm a social person, and you guys see me, and while I was wearing my mask everywhere, but these masks only go so far, I'd say. So, I mean, clearly.
Right.
So now I haven't heard. I'm still waiting for public health to call me right now, because but I did my own. I did it myself and called everyone that I'm close to or that I may have had contact with in Guam over the past week. I did that all right away that same evening. So I was even contacting some of my very, very close friends, and people I'm just in close contact with that night at like 10 o'clock at night, because I wanted them to know right away so they could even get tested if they needed to, because I don't know how I got the virus. I don't know.
Right. But Adriana, you are saying that obviously you're young, you're in this demo where we're repeatedly told by the government that the young people are going out and they're going to bars, which is, it was allowed under PCOR 3. So, that being said, would you have done anything differently, or what would you say to the people in your demo, right, who are kind of going out and doing things while other people are maybe erring on the side of caution and staying home? So what would you say to that people your age?
Well, I think to everyone altogether, I would say keep your guard up and be mindful at all times. I think we all have to be, because people go out, but it could also be just walking out the door and saying hi to your neighbor too. It could be anything. And I don't know. Of course, being in larger groups with more people, you're more prone to more infections. And especially, I wasn't sharing anything with anyone, so I really don't know how I got this. I don't know. For all I know, it could have been around someone that's asymptomatic that I'm even with all day, every day around, that I have no clue. So honestly, whenever I first got this, I was more concerned with who I may have infected, and also if someone around me that I am close to has it and doesn't even know it. I almost started crying, because I was like, someone has to have it. And we're all just going around infecting it. So I was more worried about like other people that we could be transmitting this virus to. So I even was telling my parents, I was like, I'm freaking out because I don't know who I may have come in contact with. And I also don't know who I got in contact with that's also maybe spreading this that didn't even know, because there could very well likely be people that didn't have major symptoms like I did and still haven't gotten tested.
Right, right.
How did your parents react? Because I had a conversation with my parents yesterday, and because my parents don't live on Guam either. How did they react to the news?
Well, they were very sad. Of course, they can't be here. They're not here with me. I'm here alone far away from them. So, and I have a virus that they're hearing awful things. They live in the States. So they're immediate, they're instantly calling me and checking on me all day, every day. Making sure I monitor myself. But they were the ones that kind of told me like, okay, I know you're freaking out about all these other things, but you do not need to be stressing right now. You need to monitor your own health. Remember that it's your health at the end of the day too. So you need to they were like, you need to rest. You need to take care of yourself, because if you bring yourself into any sort of stress or anything else, you're going to make this worse for you. And we can't be there. You know how that makes us feel. So they're kind of the ones that made me think like, okay, I need to start hydrating myself. I need to make sure I'm good too. Because I wasn't thinking that initially. I was just like, oh my goodness. I was on my phone, messaging everyone, calling everyone, even Sunday morning. And they're like, are you even taking care of yourself right now? Like, you realize you're gonna have to be here for 2 weeks. Make sure you're prepped, make sure everything's okay, like stay in, but you need to take care of yourself. And I was like, you're right. And I mean, they were very sad. They I mean, what would you guys are parents and you found out your child that lives far away has this, I mean, deadly virus.
Yeah.
What would they cried, of course. And, I kind of started to cry too. I was like, oh my gosh, it kind of hit me. I was like, wow, I have this in me. I don't know. It could also, the doctor did say it could change at any point. So at any point I could end up getting a fever, or at any point I could experiencing some chest pains within this next week. So that didn't really hit me at first, right? I was just kind of like, oh, I feel fine. But at any point I could not feel fine. So they definitely they brought that to light for me. They made me realize that in that moment, that yeah, it could all change right now. I mean, even today I could go throughout the day and I could just be like, oh, I don't feel well and I'd have to go to the hospital and end up in the hospital.
Well, hopefully that doesn't happen.
Yeah.
I mean,
you sound and look good.
Yeah, which is, I think, kind of scary, because I don't want people to look at you and be like, oh, COVID, But you're in good shape, Adriana. You work out, every day? And this is something we talk with Dr. He's another guy who's in good shape. And, people who are in good shape, who are younger, who don't have any pre-existing conditions like diabetes, stress, lung issues, tend to do better. And, I mean, you're an example of that. And I know you could tank either way, Adriana. So, yeah, we're definitely praying for you.
Thank you. I appreciate it. And there's, if there's anything, there's something else I would kind of like to bring to light that I've realized through this predicament, maybe more so than before, was, public health only covers COVID testing if you have the major symptoms. So if you think about it, I never had any major symptoms, and my testing went through my insurance that way, and it went through to the DLS lab. So if you think about all the others on Guam that may be a little discouraged to go get tested because they don't have insurance, but they also may not be they might not have the financial ability to foot a medical bill for testing.
It's a couple $100 if you don't have insurance.
Yes. And so there could be people that also don't have a fever or cough or chest pains, and they just think like, oh, this might be a food illness, or this might be something, so I'm not going to go spend $200 on this testing. But that's the underlying issue right there, because there might be a lot more people that haven't been tested for COVID but do have mild symptoms like I do and are feeling okay. And they can very well spread it to people that won't be in the same situation and won't be feeling okay. So, I mean, we saw yesterday, the private clinics, they reached 100 tests and they had to turn away people. So we need community testing once a week for 3 hours a Saturday. I don't think it's gonna do it for us right now, especially because if I would have not gotten tested and I would have felt better, then this virus could have just like naturally left me within a week maybe then. And then I would have spread it to work and everywhere else within that week, and I wouldn't have been known. That was a scary thought for me right there too. And we know that we don't have enough nurses to help out with these community testing, and that's why they've it's been put back. But I know that even the governor had mentioned that, I think it was in one of the recent press conferences, but she said that if an outbreak should come, that she's in communication with the Rear Admiral Manoni to, open up any on-site hospitals in the need. But I think another conversation would be, bringing some of those nurses here to help with our community testing too, considering we are shorthand as a whole, and to actually work in unison, because let me be the example here that I thought I was fine. But clearly I'm not, and I do have it.
Great.
Okay.
Well, thanks, Adriana. Yeah. And if you need anything, just give me a call.
Thank you. I appreciate it, Bree. I really do. And thank you to everyone else who has reached out that have been very kind to me during this process.
Okay, Adriana.
Okay. I'll talk to you later.
You still got to wash your hands.
Yeah, of course.
All right. And so on our end, obviously, we work in a very small office, and
Yeah.
we were kind of able to do our own contact trace investigation and figure out who came into close contact. So we've retooled our whole